Right anterior chest insertion. This video is provided for you by North American Rescue, products with a mission. The following video is part of a complete training program. Each of these objectives is designed to ensure safe spear usage. Indications, contraindications, and therapeutic benefits are important facets of safe spear usage. Identify 7 key features of the spear decompression needle system. Grasp case and ensure safety seal. Twist off cap and remove spear. Confirm landmarks. Second intercostal space, mid-clavicular line. Cleanse according to protocol or standards. Insert needle set into skin and identify rib. Confirm depth. Insert needle set less than or equal to 3 centimeters into pleural cavity. Release spin lock and thread catheter over the rib. Remove needle and disconnect one-way valve. Connect the one-way valve to the catheter hub. Secure catheter per protocol or standard. Monitor your patient for successful decompression or the development of any complications.
So needle decompression, why do we do this, right? Part of the deal, the ABCs that you remember, ABC, airway, breathing, circulation. In our world, things have changed a little bit. It's MABC, okay? So it's March, we call it massive bleeding, we're gonna stop that. Airway, touch intubation. Respiratory, we're getting into the breathing part. My biggest concern in respiratory are 2 different things. Are you moving air, okay? If you're not, we need to fix that. Why are you not moving air? If we're going to do needle decompression, I'm going to tell you a couple things, and I've used this assessment tool throughout my entire career, is just talk to people, all right? Simple senses. I really don't care what you're saying. I am listening a little bit, but I can assess this entire room by talking to people, and that's going to give me your airway status, your breathing status, so much stuff. So why do I say that? Right now, I'm talking to complete senses. I'm able to form complete sentences. If I've got a collapsed lung, all right, so when I say collapsed lung, right now our lungs are expanding all the way out. All right, I've got a collapsed lung that is basically, I have taken either a blunt force trauma and it's punctured a hole in my lung, or I've taken a gunshot wound and it's also punctured a hole, but my chest is sealed. What's happening is this lung has collapsed down into a ball, okay? And you saw the video, I believe you saw, there should be 2 videos on there. Did you show the second one too?
I only had the one.
Okay, it should be one of the lung expanding. Let's show that real quick. That's going to really demonstrate. Actually, we'll show it right at the end. Let me show you this real quick. Assessment-wise, if you're talking to complete senses, you've got an airway, right? It's patent. You're breathing okay. That's a good thing. You've got enough blood circulation that you're making some sense, all right? So you're not hypovolemic. You aren't losing oxygen from lack of red blood cells. That changes. If I go, I can't not talk, all right, that tells me something's changed. Airways changed, breathing's changed. All right, your airway's clear, something's probably changed. That lung is probably collapsed, all right? And the only way we need to fix that is to put a needle in your chest or a chest tube, a really big chest tube. But right off the bat, we're gonna needle your chest. You saw in the video how we do that. There's a couple of different things. This one is, it's a 10 gauge. All right, so we call that a big blank needle. All right, this is a spear. This is the new system that you saw in there. The biggest thing with spear in this one is, you see the difference, all right? Quite a bit of difference on there. And these have got extra holes along here. One of the biggest things with these needles is they tend to clog up. All right, so once I get in there, it tends to clog up with blood, and I have to either purge it out or put another needle in your chest. There's many pictures out there with multiple needles in people's chests, the lung keeps dropping again. All right, so since you already saw the video on that, I'm going to show you the other method, because these needles right here are $32 a piece. These are $26, all right? Okay, so I've assessed you've got some severe breathing difficulties, you're short of breath, you're not talking very fast. Okay, so you've got to fix that, okay? And you're going to see the next video after we show this and what exactly this does. All right, so that lung inside this chest is just a little ball. This side is compressing, it's expanding out just fine. This side is completely collapsed because in my chest, I've got a lot of extra pressure. The only way to relieve that extra pressure is get it out. Just like a tire. If I'm gonna poke this into the tire, it relieves the pressure out. Same thing, I've got to relieve that pressure from around that lung and allow that lung to expand back out, okay? So I'm going to, it's second intercostal space, mid-clavicular. Intercostal space is in between your ribs. So the second space between your ribs, mid-clavicular, your collarbone, all right? So to be right in the middle. You can either do it one of two ways. You can either get all the way down on the AC joint, way far out, and put your thumb in jugular knots, drop your middle finger and roll it up. Or you can just, on this one, just go roll all the other holes. All right, but all the way up, drop my middle finger, roll it up. What I want you to remember on this is when you needle the chest, all right, you're actually going to the third rib, okay? Above that rib is a second intercostal space. You're going to the third rib. And I'm actually feeling that rib, and I'm inserting this needle directly onto that rib, okay? So I'm actually touching that rib, and I'm gonna take it, I'm gonna slide it off and up and then in, okay? And you're gonna pull the needle out. Actually, this needle's already out. So all the way up, out, and slide all the way in. The video you're going to see here in a second will demo that. Sometimes you'll get a rush of air out of this, sometimes you won't. Your biggest indication is your patient status. All right, so they're starting to talk more in complete sentences. They aren't speaking in two-word sentences. All right, it's complete. All right, so do that again here. All right, assessment-wise, they're not speaking, they can't breathe. I get some different, I got one side that's going up and down, one side that's not. I determine I probably need to needle their chest, so do needle decompression. So jugular notch out to the AC joint, drop your middle finger, roll it up. I'm feeling for that third rib, all right? I'm going on that third rib. People are gonna ask, why are we doing that? It's imperative that you go up and over the rib, not to the second under it. Under our ribs lie arteries and veins, intercostal arteries and veins. If I nick that going in, I'm going to fill the chest full of blood. So it's to the third rib, up and into the second intercostal space, right? Go down in, or needle out, and bury the hub. Okay, and the video you're about to see, it'll demonstrate that a little bit better. These will often clot up, okay? They will get clot up. There's several different methods. You can actually use a syringe and burp it, a little bit of air through it. Don't push fluid in there, just burp it. Sometimes that'll remove the clot. Oftentimes you just need to put another needle in. Like I said, there's multiple pictures with many, many needles in people's chest trying to do that. PA students, anytime, everybody, anytime you needle a chest, whether they need it or not, they bought a chest tube, which means they're going to get a chest tube. That's going to go more on the axillary part. Your second time, so it's second intercostal space, mid-clavicular, or fourth intercostal space, mid-axillary, so down their armpit. All right, it's roughly nipple line. I was told by an ER physician it's where your underarm hair stops growing. That's a great spot. So it's the same thing. You're going to go on a fifth rib, go up. This mannequin's not actually designed to do this. Up and in, pull it out. Okay. Both of these work. This is where you're going to put the chest tube, this exact spot. Most of us tag team wise, I'd probably rather you just do a finger thoracostomy. Either way, I'm getting a chest tube. So I'm going to have you, it's an advanced skill. It's a 10 blade scalpel, go right into the fourth mid-axillary. I'm just going to go all the way in and puncture. That way I can get my finger in there. That's where the chest tube is going anyways. Okay. All right, so hopefully that video made sense. You saw the lung expand. It's an incredibly cool video. You saw the needle go in. So that's not a sharp needle. So people always wonder, well, that's going to puncture the lung. It rides on top of the lung. All right, so this needle is actually plastic. Okay, you see it bending. It doesn't damage the lung anyways at all. So you saw that lung re-expand. That's the goal of this whole thing, is to get that lung to expand again so they can breathe.